Okay, so now we are diagnosed our animal with Giardia. Now what are we going to do? We're going to treat it. So the first question we have to ask is, who are we treating? And if we have an animal which is clinically ill, we snap them, we get a positive, yes, we're going to treat them. What if we have done a fecal and we found Giardia but they're not sick? Are we still going to treat them? If the animal is housed, you have 5 kittens in a cage together, one of them comes up positive with Giardia, are we going to treat all the kittens in that cage? Yeah. I see some nodding in the back, very good. All right. So what I really want to labor is that our treatment is aimed to resolve the diarrhea. We want the animal clinically healthy so we can get them out to adoption or just out of the shelter. We don't necessarily want to make them SNAP negative. We don't necessarily want, or not want, but we're not necessarily going to get rid of the Giardia. And that's something really important to keep in mind. All right, so favorite choice of drug at the moment is fenbendazole, or you may know it as Panicure, which works in cats and dogs. Easy, give it once a day for 5 days. Pretty good results to resolve clinical signs, lessen the diarrhea, get rid of the Giardia. Another option, which some people have been experimenting with, is phobantol combination products, also known as Drontal Plus, which is licensed in dogs, but some people have been experimenting with it use in cats, and they have been some success. Another popular drug that people use for Giardia is metronidazole. And it's gone out of fashion recently because high doses can cause neurological signs, can cause birth defects, and shouldn't be given to nursing mothers. And of course, Giardia can become resistant to metronidazole. So you can see how that'd be a problem. Resistant Giardia, people keep increasing the dose, and suddenly you have all these adverse effects. So now that we've done our drug protocol, we need to focus on the rest of the animal and the rest of the shelter. So unfortunately, this means bathing our cats. So we need to prevent reinfection. All the cysts that are stuck in the fur, we need to get them out. We got to wash our cats and dogs. We have to clip them if they're going to be matted or getting really dirty in their hind end. And we need to clean the environment. So whatever cage they're in, we got to make sure that, oh, sorry, terribly sorry. We're going to move them to a clean environment. So we're going to move them out of the space where they were infected with Giardia, where all the cysts are in the environment. We're going to move them into a clean cage. So they're not going to be licking the walls and getting more cysts. We're going to be promptly removing the feces in that new clean environment, because even though we're treating them, they still could be shedding cysts. If they step in it, contaminate their food, it's just going to make the process harder. They're going to be reinfecting themselves. All right. So now we need to deal with our original cage, which has been contaminated by all these feces and the cysts. So first thing we're going to do is we're going to scrub. We're going to physically get in there, manually remove as many cysts as we can, just soap and hot water, and get rid of what we can. We're going to remove our soap, we're going to rinse it out, and let it dry. And the reason why we're doing these first 2 steps, getting rid of all the gunk and newspaper and whatever's left in the cage, and drying it, is so that our disinfectant is more effective. And the disinfectant of choice that we're using is a quaternary ammonia compound, or quats, and those are some brands you might be familiar with. And these have been proven to be quite effective at getting rid of the cysts. So the cysts that we haven't scrubbed out, that should be killed by the quats. All right. And we want to make sure we have a good contact time. We want to make sure we leave that quat on there for at least 10 minutes, check the label, whatever product you're using, because we really want to make sure we're killing all those cysts that are residual still in the cage. All right. We're going to wipe it clean, and then finally, most importantly, we're going to dry it. So cysts, like I said, they live in the winter, they live in the wet, they live in the damp. We need to get it dry so we can desiccate those cysts, make them so they're no longer infective. They can survive for weeks or months in a damp environment, so we really need to keep that in consideration when we're cleaning our cages. You can't just hose it down and shove new animals in. All right. So this is a picture from a shelter in New Zealand where I did a couple rotations where they had chronic Giardia and other parasite problems. And you can see, where is this animal housed? Wood. Is it indoor or outdoor? Outdoor. And I'll tell you, New Zealand has about as much rainfall as Seattle. It's always wet. So this dog is in a place that they're never going to be able to clean this kennel, right? It's going to be always contaminated with these cysts, no matter how hard they try, just because of the nature of wood and being outdoors.